All right. It is showtime, Jamie, and we're
Really?
live.
Hey,
Jamie,
Sharon, thanks for having me on.
I feel like I just saw you, and I did just see you yesterday. And I think our guests, they saw you last week. Such a great topic last week, and I think it's almost the same vein, you know. We're going to talk about financial toxicity in cancer care in the United States. And so we are ready to hear and ready to learn and ready to be able to help our constituents. So, Jamie, just introduce yourself again for the audience. Those who did not see you last week, tell them who you are, and you can take it from there.
Sounds good. Thanks, Sharon. I'm Jamie Bearse. I'm the CEO at Zero Prostate Cancer, and I'm also a board member at Cancer Equity Project.
All
So
right.
happy to be here again this week. And yeah, we're going to talk about financial toxicity. It's a term that's used to describe the harmful effect of the high cost of treatment among patients that have their quality of life be affected because of it. Uh,
Mm-hmm.
Last week we talked about patient navigation, but we're going to go through today and talk about some tips on how to deal with financial toxicity. And I care about it so much because at Zero Prostate Cancer, I just talked to so many patients over the years, and I was just reflecting before I jumped on that. So there's three scenarios that I end up running into, and I'm talking about this topic of financial toxicity. Sometimes a patient will call me and they feel really broken up because they're trying to make ends meet of taking care of their family, but also trying to get the treatment that they need and really trying to get it figured out. And then
Mm-hmm.
the next one is that a spouse or a close family member will give us a call, or I've talked to them plenty of times, and they'll say, "Oh, my husband's going through this, my brother's going through it, and he's just shut down. He's just quit the treatment because he doesn't want to put the family through this financial hardship." And then that third level is hearing about it after the fact, after they've already quit treatment altogether because of all of these pieces of financial toxicity that just make them quit their treatment altogether. And then by the time you hear about it, it's too late and it's sad. But it
That's
doesn't
a
have to.
that that last piece you said, Jamie. That's a piece that bothers me the most, right? The quitting their treatment altogether. I mean, because of it's the cost and the insurance and the issues. And I really hope that today you can shed some light on that for us because we hear about poor outcomes, and because that's the mission here, working with the disparities in care and trying to alleviate some of these poor outcomes. And the more I delve into it, there's so many elements, Jamie, to the poor outcome. It's this, right? The insurance and quitting and giving up because you just can't handle the stress of it all. And so, yeah, I'm very interested in hearing what you have to say today. So, yeah, that last piece, though, it's just frustrating for me to hear.
Yeah, it's just heartbreaking. So let's jump in. The first one that I've got is first tip is understanding your insurance coverage before you even start the treatment for what you're going through with your cancer. It's important to understand what your insurance covers and what it does not, so you can almost kind of make two columns and sort of
Right.
write out all the things that insurance is going to cover and all the things we're going to need to work on to have a game plan in order to be able to cover these things over here that the doctor's saying that you need for your treatment pathway. So then research and dive in to understand your policy, so you know what the out-of-pocket costs are going to be, what the benefits are going to be. And so with these tips, I also want to point people are watching this in the direction of some of the resources that are out there that they could reach out to kind of get some help here. So with understanding your insurance coverage, there's a few places that come to mind, which is, excuse me, the Patient Advocate Foundation is a place to reach out to that can help you understand your insurance coverage. And there's the Patient Access Network Foundation. So two different places, just sounds a lot of like. So it's Patient Advocate Foundation, Patient Access Network Foundation. The Assistance Fund is another place. And then also the Cancer Legal Resource Center, all places that you can reach out to get free legal assistance to understand your insurance coverage.
Okay. I mean,
Yeah.
because I was going to ask you that question, like, oh, gosh, who can help? I can't figure out my insurance. So,
Exactly.
all
Yeah,
right.
every November they send you like the phone book of all the different coverages and nuances that go into it, right?
That's right.
Yeah, I feel like I need to reach out to the Vatican and learn Latin in order to be able to understand it all. All right, so next up, I've got seeking out financial counseling. Just to get this out of the way, last week we talked about patient navigation. It's sort of the same thing what I'm talking about here, but it's important to continue to bring up and deliver that message. There are some bigger hospitals and some cancer centers that have financial advisors who can help you navigate the cost of the cancer care that you go through. But oftentimes, if you're going to get it, you're going to have to turn to some of the nonprofits out there to get it. And that's getting some understanding with some of your budgeting and understanding what's going to get covered and what's not going to get covered, what
Right.
might be able to go on a payment plan or some other financing plan, and they can go over some of those kinds of options with you.
Jamie,
And
I'm sorry to cut you, but someone was asking this. It's a very important question because
right,
you give us like two or maybe four resources, and I jotted down two, but I'm not going to be able to jot them all down. But they're so important. Someone was asking, can we list these website on your website? But I'd like to list them maybe even somewhere on our website. So I'm going to ask you after this broadcast if you could just send me your resource list so I can put it in the comments here and also maybe link them somewhere else as well, because I think they're just so important. So sorry to cut
absolutely.
you extreme, but yeah.
No, not at all. It's a very important question, and yeah, we'll get it up in the chat and up on the website for sure. So speaking of resources around seeking the financial counseling, there's quite a few of nonprofits out there that do that. A couple that I didn't bring up last week that are worth looking into to get some of that financial counseling is the Cancer Financial Assistance Coalition. They can connect you with a financial counselor who's in your area. I don't know if they do sit downs, but that's something we'll have to look into. And the other one that I thought of is financial assistance for cancer treatment.
Wow.
So they're out there, and they actually have a free financial planning toolkit for if you're going through treatment.
That's good
So
to know.
again, we'll put that up.
While you're getting to your next point, there's a quick question in the feed for you. To what extent do you think things like Medicaid expansion are helping to reduce inequities in cancer care? Is it, and what states still need to adopt this? I don't know. What are you seeing over there at Zero?
Yeah, so that's a good question, Peter. We might have to do a whole 10 to 20 minutes just on answering this question. It's pretty complicated. Yeah, to what extent has Medicaid expansion helped out with reducing inequities? Not enough. I think that's the really short answer. Not enough. And I base that off of I can base it off a lot of things, but the first thing that comes to mind is knowing that we at Zero have this program. It's my favorite program that we do. It's called 0360. We talked about it last week. It's a patient navigator program, and the demand for financial support or being underinsured or uninsured continues to be a skyrocketing problem. We are fighting to have enough resources in order to be able to just help prostate cancer patients through that program, and through other organizations that I've talked to that I'm networked or connected into. The same is pretty much true for them. So, as far as Medicaid expansion, trying to bring down some of these inequities or at least financial toxicity, not enough.
Not enough. Wow. That's too bad. Okay.
It is. The next tip that I've got is exploring financial assistance programs. And we touched on it really quickly last week, but there are funds out there that are designed specifically to be able to pay copay relief. So going back to that first point that I made around understanding your insurance coverage and what it covers and what it does not, most of them do not cover copay. That's something that you're going to have to kick in.
Right.
And if you're a patient out there watching this, we're talking copays that get into 4 figures, even 5 figures sometimes for a copay. But there are programs out there that can help you find that. For example, if you're dealing with a blood cancer, Leukemia Lymphoma Society has a copay assistance program. I mentioned on another point, the Patient Access Network Foundation does copay relief. Another place called the Assistance Fund, and then the Health Well Foundation. So again, we'll put these resources out there, but they're available for folks too.
It's good to know that they exist, though. Too. I'm gonna punch one more in. One more Peter question. We may have to ban Peter if he keeps throwing us hard questions, but.
You have to have them on. You bring up a third window here.
I know, right? He's going to actually be on a couple of Thursdays for us. But not only the treatment cost of being off work, getting to and from radiation therapy appointments, infusion appointments, etc. Part of the whole financial burden on the patient, is what he's saying right here. We have the treatment costs, right? And then we have the loss of income costs, right? Transportation costs, the appointments, it's, I don't know how one deals with that too, Jamie. I don't know if you have that as part of your notes, that over and above the insurance issues, is there any assistance for supplementals like this? Like, okay, I'm going to be out of work, but I'm a single mom. I don't know, how do we fix that gap in the pay, that gap in the paycheck? That's so prevalent, where women literally judge, they make a decision between their radiation treatment and food on the table.
That's right. And it connects back to a bit of what we were talking about last week around patient navigation, or talking to one of these financial counselors that are at some of these bigger hospitals and cancer centers, because they can be able to direct you to resources or connect you with places who can be able to step in and provide those types of things. Like, say, you're looking at your finances in a way that, because so much is going out the door to your cancer treatment, that now you either qualify for food stamps or you qualify for any kind of relief like that. That we can be able to get a hold of resources to be able to help in that regards too. But there are funds out there that help with what you're talking about and it really runs the gamut from getting some of these medical needs covered, not necessarily like treatments and things like that, but you have to go to the CVS to get, I don't know, the Advil or the Tylenol or the anti-nausea medication that's over the counter, all those kinds of things. There is help out there to be able to get a hold of that. So I think the best places to go and look for that are these places that have the patient navigator, or the places that have that financial consultant.
Yeah, well, that's one of the things, as you're talking, I'm thinking, man, our journey map will definitely have to have, when we talk about the hurdles, we saw a preview of the map yesterday, what it's going to look like. And when we saw the hurdles, these hurdles is where we want to list these resources, like you're talking about now. So it's good.
Definitely. And to what we're talking about is being able to negotiate medical bills. So that's not just the treatment, but some of these follow-ups to see the doctor and checking in with them. That a lot of people that don't know this, but a lot of providers out there, a lot of healthcare providers will negotiate with you. If you receive a bill that you can't afford, then don't hesitate to call them up and try to negotiate with your healthcare provider.
Can we talk about it for 2 seconds? Because right. I saw you mentioned that to me before, and I'm thinking, really? I mean, have you seen that work where, or have you heard of that working for anyone where the doctor bills me, let's say $1,000, but I mean, I can't afford it. I can afford maybe 500. Would they actually work with me to bring my bill down, to take what I can afford? I mean, have you seen that work for any of your patients or anything?
Yeah, it's part of what the patient navigators do now that we have in our program. They oftentimes will call up and talk directly to the provider and
Wow,
negotiate something that is reasonable that the patient can afford.
that's
Uh,
really good.
yeah, I mean, we're working to empower people to be self advocates as a patient or as a care provider or
Yeah.
caretaker. So we have to be smart about it when we call up our providers and or the doctor's office and talk to them about what we're able to do. It's like what's that old saying that my mom used to say to me? You catch more flies with
Flies.
vinegar, right? If you
More
know
flies
anything
with
about
honey.
with honey, yeah. With
More,
honey, more honey than with honey than you do vinegar. So
we're
you don't
showing
want to
our
call
age.
up and say, "What?
Okay.
I can't afford this. This is nuts." But you're probably not going to be able to, to
Yeah.
negotiate.
But
But yeah,
you're making a good point, Jamie. Because again, every time you talk, I'm always like my mind's always good when you talk to me. So when you
thank you.
talk about the negotiating and how we're trying to empower patients to negotiate for themselves, to be their own advocate, and I'm thinking in my head, where can we put a script, or where can we put a quick video,
Mhm.
or something, maybe on our site, or on our site, or I don't know, somewhere that shows, here's a tactic, here's an example of how you want to talk to your doctor. Because you're right, the flies to vinegar, flies to honey thing is true. So almost like best practice, or best lingo, or best tactic, or best scripting would be something. Maybe you and I can talk about that when we
Love
meet
that
again,
idea.
because that would be a big help. All right.
That's a great idea, Shannon. That's great. I love that. Let's do that. The next one that comes to mind is consider. Do you want to pause for a question?
I was gonna make you finish yours, and I'm gonna ask this one.
Okay, I will finish this up. Consider clinical trials. Clinical trials, especially among people who are in historically marginalized communities, especially when it comes to healthcare, are far underrepresented when we're talking about clinical trials. But
Yeah.
one of the benefits of getting involved in clinical trials is that oftentimes at that trial will be able to cover all the other costs that go along with your treatment as free or reduced for participants who enroll in clinical trials. So
Oh,
before, yeah, so before participating in a clinical trial, make sure to, I want to say, with a caveat, I just want to make sure that I'm saying that carefully review the study's protocol and the potential risks that go into a clinical trial. Again, there are navigators out there that can help break down for you what trials would be a good fit. Talking to your doctor is at the top of that list. But NCI, National Cancer Institute, has a list of clinical trials, and also clinicaltrials.gov. I'm going to say it that sometimes it comes across as clunky to use, but I'm fine that there isn't another resource out there that is more thorough in the number of clinical trials that are out there that you can look at. But considering a trial, they can reduce some of your other treatment costs.
I really wish that this message, and part of our mission, the message of clinical trials, would get out there more, especially in the underrepresented communities. Because like what you just said, I never thought of it this way. You think of clinical trial, you think of, okay, I'm going to take this trial so that or participate in this trial so that I could perhaps get a better outcome for my cancer, right? I mean, that's the whole idea. Like, this cutting edge may work for me, and we've heard many stories of that working for people. One of our board members, talk about her trial 15 years ago, being part of that and how it helped her. But what you just said too, it's also a financial help, because I never thought of it, that when you're in a trial, your medicine is free, all of that is free. I mean, yes, look at the risks, but on the upside, there's a financial benefit as well. So that's also very good to know. Okay, question for you. People think of things like surgery and chemo as the main cost of upfront cancer treatment, but how can patients seek financial assistance for things like adjuvant treatment? Example, that in prostate cancer, which are more long term and can go on for years. It's a good one.
Yeah, absolutely. When it comes to patient copay relief, most of those funds are based around those types of treatments. When we're talking about androgen deprivation therapy, hormone therapy, immunotherapy types of treatments. They don't necessarily cover those frontline treatments like surgery. However, I'll go back to say, reaching out to a patient navigator and being able to network into some of these local entities that may be able to cover costs. It doesn't even hurt to ask the hospital. Sometimes, if somebody is really struggling, you're out of work, you're bankrupt, there is a budget at some of these hospitals and cancer centers to be able to provide some financial aid as well. So don't be shy about asking about all, any and all avenues that are out there that you could use at your disposal. Look, we're talking about cancer here. Like, this is a battle. This is a battle for your life. So you need to look at all avenues. All avenues are at your disposal to be able to beat this disease.
I think the message I'm hearing a lot today, there's a theme of what you're saying today, Jamie, is being your own advocate, asking, and goes back to why we're so big on educating that patient. This is why Tea Talks is. I'm not trying to push the show, but I mean, I learn every time I'm on the show. I mean, I learn something every time I have a guest on here. But this is the reason why this is such a good medium, because it's all this free information for people. And I'm hoping that as people are listening, and if you are someone is unfortunately diagnosed with this disgusting disease, that share this with them. I mean, there's stuff out there that you're listing off a bunch of resources that we didn't know about and never thought of. I'm just going to front a couple of these questions because some you already answered. This one, you said, are there resources for people to use when disputing a medical bill? I think we're going to list those resources afterwards, Maddie. Jamie discussed some of those resources earlier. So we're going to list them in the feed afterwards, and we're going to maybe try to find a place to put them on our website as well. And I think this one, are public hospitals as an option if you can't afford a private hospital?
Yeah, of course. They're always an option on wherever you can get treatment. I would just advise that whoever's doing treatment on you as a cancer patient, you always want to try to be patient number 25,000 rather than patient number 2 that they're trying a particular treatment on.
And I think we answered this one just now. I know a big part of Cancer Equity Project is working to increase our minority enrollment in cancer clinical trials. What are some ways clinical trial participation help to offset the financial toxicity of cancer care? You just answered that beautifully by saying, hey, sign up for trials if you can, because it's going to be free. It's going to be free to you. Your treatments are going to be free. Just know the type of trial that you're signing up for. And there are resources that we're going to put online to know how to vet those trials. So great.
Yeah, that's right.
More points. Yes.
All right. So I would say look at utilizing generic medications. Sometimes it doesn't make sense, but sometimes it does as well. So ask your doctor, ask your pharmacist if there's generic versions of the medications that you have to take to fight your cancer, because genetic medications are significantly cheaper than brand new medications. And as I said, oftentimes there's there's not much of a difference there.
Mhm.
Make sure to ask about it. It depends on what kind of drugs we're talking about. But a couple of good resources there to ask about getting generic alternatives to your medications is the Partnership for Prescription Assistance. And one of my favorite places that I've seen patients use time and time again, and it's needymeds.com. So that both of those are terrific resources that I've seen help countless patients to help find their medication, or give them medication assistance.
That's awesome. I mean, all these resources are there, but I don't know who is giving all this information to patients.
Who's giving information to patients as far as these resources, do you mean?
Yeah, because the reason why patients forego treatment, the reason why patients give up is because they're not hearing about these resources. And I'm just wondering, is that at the doctor level, at the hospital level? I mean, how are patients? I mean, how are they supposed to know, especially if they're not? How should I say this? Especially if maybe their education level is not advanced, right? A lot of patients, Google, right? Providing that they have a computer or an iPhone or whatever. But and this is again this part of the struggle for the underrepresented groups, because they lack some of these resources, right? Just even the technology to know where to go. And I'm just wondering, geez, should doctors be doing a better job of that? Like on my particular journey, now maybe I didn't need that because I had insurance. So there was no need to tell me about other places. But it would be good if I even saw something in a doctor's office that said, hey, financial assistance needed, come over here to these pamphlet or something. It's just that 15-minute in, clinical and out. And again, pushing our journey map, it's the reason why there's such a need for it. Because if we can get the doctors to at least point to our website, or we can at least help people with all of these resources, like here's where you're at and here's where you can get help. Because otherwise, I just don't know how people who are not in the know, I don't know how they find out. Because I've been to 4 different doctors on my journey, and nowhere do I see anything about financial assistance. So I'm just curious, like how are people even knowing this stuff?
Yeah, well, the information is out there, um, but you're right. Sometimes we don't know where to look in order to be able to find it. And I think at the bare minimum, one of the things to take away from our talk today, and as we continue to have more and more conversations about trying to erase inequities in healthcare around cancer, is to be able to um, ask for help.
Yeah.
And it's so hard for us to ask for help sometimes. We're so hardwired
Hmm.
into, well, I've got to figure this out. This is my problem. It's my issue. It's my journey. I've got to figure it out. So we're, like I said, we're just hardwired to load all of this on our shoulders and not actually ask for help.
Hmm.
And if we can flip it around and think of it in a way of, it's really uplifting for other people. If you want to care about others, you can almost like care about others by caring about yourself, because asking for help, it lifts up other people. Because so there's so many of us out here around the world who want to help others be able to get through their challenges in life. So that's almost like number one right there. And I don't mean to bury the lead, but just reach out and ask for help. And if the first person that you ask is not offering much help, or maybe sending you in a direction that is nice, but isn't all that helpful, then ask somebody else to be able to help direct you to where to look for some of these resources, or to really just take you by the hand to those resources so you can get the help that you need. But it is out there.
Well, Jamie, I know you may have more to say, but I'm gonna end it right here because we're at 30 minutes. But I also, because I really like that ending. I really like what you said there. That actually really touched me in a certain way. What you said, that when you ask for help, you're lifting everyone else up, because there are people out there, there are good people out there who really do want to help you on your journey. Um, and it's two sides, right? The journey of the patient can feel very isolating and very lonely, right? And especially if you were an independent person before your diagnosis, so you can feel very isolating. But I want to end the tea talk on that note, for the listener, for the patient, for the future patient, unfortunately, for caregivers, for advocacy groups who meet with patients, is to, I want to leave it at that, that ask for help. And if the first person cannot answer your question, don't give up. Keep asking for help, because there are good people out there and great organizations out there who do want to help you. And when they help you, they actually feel good about what they're here to do as well, and what they're called to do as well. So it was a very encouraging talk, Jim. And I know you may have one final word. I'll let you leave us with your final word.
I was just going to add on to what you had said, that think about it in terms of, if a cancer patient came up to you and asked you for help on where to go, how would you feel? What would you say? Chances are your heart would go out to them. You'd want to help them as much as you can. That's how people, that's how others, that's how we have to view other people around us, ready to be able to help us get over these challenges, because we'd all want to do it for each other.
That is a good point. All right.
My
Well,
friend,
it's a great Jamie Bearse, ladies and gentlemen. We thank you so much for watching and for supporting our Tea Talk, and we are just, just grateful to bring this information to you. And like I say, I learn every time I'm here, and I'm hoping that as you are watching on the replay, that you will share our Tea Talk, because it is a resource that we at Total Health and Cancer Equity provide for you, our listening audience. So thank you so much, and join us tomorrow. We have another great, exciting guest tomorrow at 2 o'clock right here on Tea Talk. Take care.